Thank you, Mr. President. Excellencies, distinguished delegates, colleagues, all protocol observed. I want to start by thanking the Human Rights Council for calling for this panel and the core group, Colombia, Portugal, and Thailand, led by Brazil, for their continued support for the centrality of human rights within the HIV response. That continued support has been critical in enabling us to reach people living with and affected by HIV, particularly those most marginalized and most vulnerable. In 2023, we had over 30 million people on HIV treatment. Between 2010 and 2023, annual numbers of new infections reduced by almost 40%, and AIDS-related death more than halved. People living with HIV on treatment have a life expectancy similar to the rest of the population, and we're seeing new and longer-acting prevention and treatment options coming down the pipeline. But this is where the good news ends. Annual new HIV infections are rising in 3 regions: Latin America, Eastern Europe and Central Asia, and in Middle East and North Africa. In 2023, 630,000 people died of an AIDS-related illness. 9 million people are still not on treatment. Among young people in sub-Saharan Africa, 77% of new infections were among adolescent girls and young women, and 42% of children living with HIV are still not on treatment. Key populations, as has already been referenced, are up to 23 times more at risk of acquiring HIV than for the rest of the population. Today, we stand at a crossroads. We have the tools and we have the expertise to end AIDS as a public health threat by 2030, but our current efforts will not get us there. This is not a failure of technology. This is a failure of political commitment and support for human rights. Stigma, discrimination, criminalization, and shrinking civic space are creating barriers to HIV services, leaving key and vulnerable populations behind. We need a sustainable, rights-based and evidence-based approach to HIV that leaves no one behind. For UNAIDS, such a sustainable approach refers to an enabling environment with people-centered human rights and gender equality-based systems for health and equality, empowered and capable institutions and community-led organizations, and adequate, equitably distributed resources to reach and sustain the end of AIDS as a public health threat by 2030 and beyond, upholding the right to health for all. For over 25 years, UNAIDS has been working with governments, with communities, with donors and other UN agencies to put human rights at the center and to create a response that meets current and emerging needs and realities. Today, there is an urgency to both scale up the response and to move to a more sustainable approach. UNAIDS has been working with countries to develop sustainability roadmaps to create longer-term sustainable responses that do not lose the human rights gains we have made and that do not leave people behind, that leaves nobody behind. Ultimately, this is about reaching people with information, with prevention services, with testing and treatment services, and empowering them to protect their health. This means, 1, removing HIV-related stigma and discrimination, not just with ad hoc interventions, but with systemic change and structurally embedded oversight and accountability. It means, 2, to create enabling legal and policy environments, including removal of harmful criminal laws, and train judiciary and law enforcement agents to ensure implementation. And 3, to reduce gender inequalities and harmful gender-based norms in all areas of life. And 4, to maintain a strong civil society and civic space. I cannot emphasize this enough. Community-led service delivery has been a game changer for key populations and young people, providing stigma-free services accessible to marginalized populations. And 5th, both domestic and international funding will be required for the foreseeable future. In 4 geographical regions in 2023, international funding accounted for more than 50% of funding for societal enablers. Ultimately, a sustainable response to HIV is possible only where the human rights of people living with or affected by HIV, including key populations and adolescent girls and young women, are respected, protected, and fulfilled to ensure accessible, acceptable, and high-quality HIV services for everyone. I thank you.